There's a single symptom that signals early liver damage in millions of people, and almost everyone who experiences it puts it down to something else entirely. They blame their sleep, they blame their age, they blame their stress levels or their diet, or just feeling a bit run down. They almost never connect it to their liver because the liver is one of the quietest organs in the body. It doesn't have pain receptors in the way other organs do. It doesn't ache when it's struggling. It doesn't send obvious distress signals. It just keeps working and working and working until one day it can't anymore. The symptom I'm talking about is persistent unexplained fatigue, particularly the kind that hits you in the late morning or early afternoon and doesn't lift no matter how much coffee you drink or how well you slept the night before. On its own, fatigue is one of the most common complaints in primary care, and most of the time it's not liver related. But when fatigue is combined with a few specific patterns I'm going to walk you through today, it can be one of the earliest warning signs of a condition that now affects roughly 1 in 3 adults in the developed world. That condition is non-alcoholic fatty liver disease, and what we're now understanding is that the vast majority of people who have it don't know they have it. They're not heavy drinkers. They're not obviously unwell. They're walking around with a liver that's quietly accumulating fat, becoming inflamed, and starting the slow process towards scarring, all without producing the kind of dramatic symptoms anyone would recognize as a liver problem. And the reason most people miss it is that they've been told to look for the wrong signs entirely. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in AAN-EE, I've seen what happens when preventable disease isn't prevented. I've seen patients in their 50s and 60s come through the department in advanced liver failure, and looking back through their records, the warning signs were there for years. Mild fatigue, slightly off blood tests that nobody followed up, weight that had crept on around the middle without anyone connecting it to what was happening internally. And my goal now is to help people recognize those signs earlier when there's still time to reverse the process so they can live longer, healthier, more independent lives. So let me make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research, to help you live longer and to help you prevent the diseases I see in the emergency department every single day. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time, or you've not learned something new, then feel free to unsubscribe, no hard feelings. But if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you, and let's continue. So before I get into why fatigue specifically is such an important early sign, we need to spend a few minutes understanding what your liver actually does, because the symptoms only make sense once you understand the jobs the organ is failing to perform. Most people think of the liver as a detox organ, and that's true, but it's only one of around 500 separate functions the liver performs every single day. Your liver is the most metabolically complex organ in your body, and when it starts to struggle, the consequences ripple outward into systems that nobody would think to connect back to the liver. That's the central problem. The liver doesn't complain in its own voice, it complains through other organs. The first major job is metabolism. After you eat a meal, the nutrients absorbed from your gut travel directly to your liver before they reach the rest of your body. Your liver decides what to do with those nutrients. Glucose can be burned for immediate energy, stored as glycogen for short-term reserves, or converted to fat for long-term storage. Amino acids from protein can be used to build new proteins, broken down for energy, or converted into glucose. Fats can be packaged into transport molecules for delivery to other tissues, used to build cell membranes, or stored. The liver is essentially the central processing facility for everything you eat. When the liver becomes overloaded with fat, this entire processing system starts to slow down. Energy distribution becomes less efficient. The body has to work harder to do the same metabolic tasks, and that inefficiency shows up as fatigue. The second major job is detoxification, which most people have heard of, but few understand properly. Your liver processes everything that enters your bloodstream, whether it's medications, alcohol, environmental chemicals, hormones, or natural waste products from your own metabolism. It runs each substance through 2 phases of detox enzymes, modifying it chemically so that it can be safely excreted in bile or urine. When the liver is healthy, this process runs efficiently in the background. When the liver is fatty and inflamed, the detox enzymes work less efficiently. Substances that should be cleared quickly linger in the bloodstream for longer. Hormones that should be broken down accumulate. Medications can have stronger or longer-lasting effects than they should. The result, again, is a system running at reduced capacity, and the body feels it as a low-grade exhaustion that doesn't have an obvious cause. The third job is producing essential proteins. Your liver makes albumin, which is the most abundant protein in your blood and which helps maintain fluid balance in your tissues. It makes clotting factors, which are essential for stopping bleeding. It makes proteins that transport hormones, vitamins, and minerals around your body. It makes immune proteins that help fight infection. When liver function declines, all of these proteins are produced in lower amounts, and the consequences show up everywhere. Fluid leaks into tissues because albumin is low. Bruising happens more easily because clotting factors are reduced. Hormones don't get transported properly. Immune function becomes less effective. None of these symptoms scream liver problem to the average person. The fourth job is bile production. Your liver produces around 1 liter of bile every day, which is essential for digesting fats and absorbing fat-soluble vitamins like A, D, E, and K. Bile is also one of the main routes through which your body excretes cholesterol and waste products. When liver function declines, bile production becomes less efficient, fat digestion suffers, and certain vitamins become harder to absorb. People may notice that fatty meals cause them more discomfort than they used to, or that they feel sluggish after eating. Again, easy to dismiss as just getting older, or eating too much, or any number of other explanations. So what we have is an organ doing hundreds of jobs simultaneously, with no pain receptors to alert you when it's struggling, and where the symptoms appear in distant systems that almost nobody connects back to the liver. The fatigue is the body's way of telling you that the central processing facility is operating at reduced capacity. It's the most common early signal, and it's the one almost everyone ignores. Just really quickly, if you're getting value from this video so far, please consider subscribing. The mistake almost everyone over 40 is making is assuming that liver disease is something that happens to heavy drinkers, intravenous drug users, or people with hepatitis. Those are real causes, and they matter, but they account for only a fraction of liver disease today. The dominant form of liver disease in the developed world right now is non-alcoholic fatty liver disease, which has nothing to do with alcohol consumption. It's driven primarily by the modern diet and metabolic dysfunction. And here's where it gets concerning. Research published in journals like The Lancet Gastroenterology and Hepatology now estimates that around 30% of adults in the developed world have non-alcoholic fatty liver disease, and that figure rises to over 70% in adults with type 2 diabetes. The vast majority of these people have no idea. Their liver function tests on standard blood work often come back within normal limits, particularly in the early stages, because the liver has enormous reserve capacity and the standard tests aren't sensitive enough to catch the early changes. This isn't your fault. The standard medical model wasn't designed to catch fatty liver disease early. The blood tests most commonly used, ALT and AST, only become clearly abnormal when significant inflammation is already present. By the time these markers are obviously elevated, the disease has often been progressing for years. There are better tools, things like specialized ultrasound techniques, MRI-based fat quantification, and a calculated score called the FIB-4 index, which uses standard blood markers in a more sensitive combination, but these aren't routinely ordered for people without obvious risk factors. The system is set up to catch the disease once it's manifested clearly, not to catch the trajectory toward it. Let me give you 4 examples of what this looks like in everyday life. The first is the person who feels persistently tired, particularly in the late morning, despite sleeping 7 or 8 hours a night. They don't have any obvious medical condition. Their blood work, the basic version their GP runs, comes back essentially normal. They've tried more sleep, more coffee, more vitamins, exercise, and nothing really shifts the fatigue. What they don't realize is that this kind of metabolic fatigue is one of the earliest signs that the liver is becoming overwhelmed. The energy distribution system isn't working as efficiently as it should, and no amount of caffeine or sleep can fully compensate. The second is the person who has slowly accumulated weight around the middle over the past decade. Not a dramatic change, maybe 10 or 15 pounds, mostly around the waist and abdomen, while their arms and legs have stayed relatively similar. They blame age, they blame slowing metabolism, they blame their lifestyle. What they may not realize is that abdominal fat is closely linked to fat accumulating inside the liver itself. The two go together. The visible weight around the middle is often a marker for the invisible fat accumulating inside the organ. The third is the person whose blood sugar has been creeping into the pre-diabetic range over the past few years. Their fasting glucose used to be in the low 90s, and now it's in the high 90s or low hundreds. Their HbA1c, which reflects average blood sugar over 3 months, has been edging up. They've been told to watch their diet and get more exercise, but nobody has connected the rising blood sugar to what might be happening in their liver. The truth is that fatty liver disease and insulin resistance form a feedback loop, each making the other worse. Treating one without addressing the other rarely produces lasting change. The fourth is the person who finds that alcohol affects them differently now than it used to. 1 or 2 glasses of wine that they used to handle without any problem now leaves them feeling rough the next day. They may notice that their tolerance has decreased or that hangovers are more pronounced. They put it down to age. The reality is that a fatty, inflamed liver processes alcohol less efficiently than a healthy one. Even modest amounts of alcohol have a stronger and longer lasting effect when liver function is compromised. These patterns are not unusual. They're the default experience of millions of adults in their 50s, 60s and beyond. They look completely normal from the outside. But underneath, they may be early indicators of liver dysfunction that, left unaddressed, can progress over decades into serious disease. Now I want to walk through what actually moves the needle, because I'm not advocating for extreme approaches here. You don't need a juice cleanse, an elimination diet, or any of the liver detox products that fill the supplement aisle. The liver doesn't need to be detoxed. It is the detox organ. What it needs is a reduction in the metabolic load it's been carrying, so it can repair itself and restore normal function. The good news, and this is genuinely encouraging, is that fatty liver disease in its early stages is one of the most reversible chronic conditions we know of. The liver has extraordinary regenerative capacity. Give it the right conditions, and it can heal in ways most other organs simply cannot. The first action is reducing the intake of refined carbohydrates and added sugars, particularly fructose. This is the single most impactful change for fatty liver. When you consume large amounts of fructose, whether from sugar, high fructose corn syrup, or excessive fruit juice, it travels straight to your liver for processing. Unlike glucose, which can be used by virtually every cell in your body, fructose is metabolized almost exclusively by the liver. When the liver receives more fructose than it can immediately use, it converts the excess into fat through a process called de novo lipogenesis. That fat then accumulates inside the liver cells. Reducing the intake of sweetened drinks, processed foods, and refined carbohydrates is the most direct way to reduce the fat-producing pressure on the liver. Research published in the Journal of Hepatology has shown that this single change can reduce liver fat measurably within weeks. The second action is gradual, sustained weight loss if you're carrying excess weight, particularly around the middle. The research is consistent here. A weight loss of around 5% of body weight tends to reduce liver fat significantly. A weight loss of 7 to 10% often reduces inflammation. A weight loss of 10% or more can sometimes reverse early scarring. This doesn't have to happen quickly. Slow, sustainable weight loss tends to be more effective for the liver than rapid weight loss, which can sometimes worsen liver function temporarily. The third action is regular physical activity, both aerobic and resistance training. Exercise helps in 2 ways. It improves insulin sensitivity, which reduces the metabolic pressure on the liver, and it directly mobilizes fat from the liver to be used as fuel by working muscles. Importantly, the benefits of exercise on liver fat occur even without significant weight loss. Studies have shown that consistent moderate exercise reduces liver fat content even when body weight stays the same. So if weight loss is challenging, the activity itself is still doing meaningful work. The fourth action is moderating alcohol intake. Even though non-alcoholic fatty liver disease is by definition not caused by alcohol, drinking on top of an already fatty liver accelerates the damage significantly. The combination of metabolic fatty liver and regular alcohol is far more harmful than either alone. For someone with suspected or confirmed fatty liver, reducing alcohol significantly, ideally to minimal or no intake for a period, allows the liver more capacity to repair itself. The fifth action is paying attention to medications and supplements that put additional load on the liver. Many common medications, including some over-the-counter pain relievers, certain cholesterol medications, and many supplements, are processed by the liver. None of these need to be stopped without medical guidance, but it's worth having a conversation with your doctor about whether your current medication list is appropriate, particularly if liver function tests have shown any abnormalities. The goal is to reduce unnecessary metabolic burden where possible. Here's where I want to be clear about something. I'm not suggesting anyone stop taking their medication or change their treatment plan without talking to their doctor. Medication and lifestyle are not opposing forces. They work better together. If you're on prescribed treatments for blood pressure, diabetes, cholesterol, or anything else, please continue working with your prescribing clinician. What I'm offering is a foundation that, in many cases, makes those medications more effective and sometimes allows for adjustments over time under medical supervision. This is about adding to your treatment, not subtracting from it. In emergency medicine, I've seen the consequences of late liver disease detection more times than I want to count. The 60-year-old who came in with what looked like a stomach problem and turned out to have advanced cirrhosis with no prior diagnosis. The 55-year-old whose first sign of liver disease was bleeding from varicose veins in his esophagus, a complication of long-standing portal hypertension that nobody had picked up. These cases are not unusual. They're the predictable outcome of a disease that progresses silently for years before producing the kind of dramatic symptoms that bring people into AAN. And in almost every case, the early signs were there. Fatigue, mild metabolic abnormalities, weight changes, vague digestive complaints, none of them flagged as liver-related until it was too late. But I've also seen the other side, and this is the part I want you to hold on to. I've had patients diagnosed with fatty liver disease in their 50s who, after making targeted changes to their diet, their activity, and their alcohol intake, completely reversed the fat accumulation in their liver within a year or two. Their blood tests normalized, their fatigue lifted, their blood sugar came down, their waist circumference reduced. One patient in his early 60s told me that addressing his fatty liver was the catalyst that transformed his health. 5 years on, his liver imaging showed no evidence of fatty infiltration, his blood pressure was well controlled on a single medication, and he had more energy than he'd had in 20 years. The liver is forgiving when you catch it early. The damage that has occurred in the early stages is largely reversible. When you zoom out and think about what liver health really represents, it's not just about avoiding cirrhosis. The liver sits at the center of metabolic health. People with fatty liver disease have substantially higher rates of cardiovascular disease, type 2 diabetes, certain cancers, and overall mortality. Protecting your liver protects everything downstream of it. The choice isn't between living a normal life and obsessing over your liver. The choice is between paying attention to a few specific signs and a few specific patterns and getting the right tests when warranted, versus discovering the problem decades later when reversal becomes much harder. The fatigue is the warning. It's quiet, it's easy to dismiss, and it's almost always blamed on something else. But for a significant number of people, that persistent unexplained tiredness is the body's way of telling you that the most metabolically critical organ you have is asking for help. Now you know what to listen for. If you found this useful, please subscribe to the channel.